Today's paper explores how comorbid generalized anxiety disorder or GAD affects cortical folding patterns in panic disorder or PD patients. Comorbid GAD in PD patients leads to worse clinical outcomes, but brain structural correlates remain unclear. Previous studies examined PD or GAD individually, but this is the first to compare cortical gyrification in PD with and without GAD. The study investigates whether comorbid GAD induces distinct cortical folding changes in excessive worry-related brain regions. The researchers analyzed MRI scans from 30 PD plus GAD patients, 60 PD-only patients, and 65 healthy controls using FreeSurfer for local gyrification index or LGI calculation. Participants also completed validated scales for panic, worry, suicidality, harm avoidance, anxiety, and depression. PD patients showed increased gyrification in regions of the extended fear network, like the frontal and insular cortices. PD plus GAD patients exhibited additional hypergyrification in the dorsolateral prefrontal cortex, superior parietal lobule, fusiform gyrus, and middle temporal gyrus. These regions are involved in worry processing, attention, emotion regulation, and somatosensory integration. In PD plus GAD patients, higher LGI in the superior frontal gyrus was linked with greater suicidality. Similarly, higher LGI in the superior parietal lobule correlated with harm avoidance, a trait anxiety marker. These findings suggest that comorbid generalized anxiety disorder reshapes brain structure beyond the typical panic disorder profile. This is the first evidence showing unique dysgyrification patterns associated with excessive worry and panic disorder, plus generalized anxiety disorder patients. Gyrification patterns may serve as neurobiological biomarkers to distinguish panic disorder with generalized anxiety disorder from panic disorder alone. Identifying these patterns can help clinicians assess suicidality risk and anxiety sensitivity more effectively. The study provides a step toward personalized psychiatric treatment, especially for high-risk anxiety patients. LGI patterns may inform early intervention strategies and tailored therapeutic approaches. Future longitudinal studies are needed to confirm whether these patterns predict clinical progression or treatment response. Examining gyrification in drug-naive patients or during treatment could offer deeper insight into brain plasticity. This research brings us closer to precision psychiatry in anxiety disorders by uncovering structural brain markers of comorbidity.